This week is Diabetes Awareness Week, and today I'd like to raise awareness of the typical symptoms that suggest a diagnosis of type 1 diabetes. Now, type 1 diabetes accounts for approximately 8% of diabetes, but is the type of diabetes we most commonly see in children and young people, although in fact it can present and be diagnosed for the first time at any age in life. Now, at the onset of type 1 diabetes, the symptoms very typically develop fairly rapidly over a matter of days or weeks, and if not diagnosed early, can progress to a potentially life-threatening condition known as diabetic ketoacidosis, or DKA. Now, we need to prevent DKA, and in order to do that, we need to raise awareness of the symptoms that suggest a diagnosis of type 1 diabetes. Diabetes UK has a campaign known as the 4 Ts that describe the 4 most typical symptoms, and they are toilet, thirst, tiredness, and thinner. Now, just to explain those, when you develop type 1 diabetes, it causes your blood sugar level to become very high, and a consequence of that is that you will generate larger volumes of urine, and hence that will make you go to the toilet more frequently, but also to pass larger volumes. Now, in a young child, that might manifest with more wet nappies or perhaps a recurrence of bedwetting, so they might also be important symptoms to recognise. You can imagine that if you're passing larger volumes of urine, you're likely to become dehydrated, and hence you will feel thirsty. When you have type 1 diabetes, your body is unable to use glucose as a source of energy, so hence you will feel very tired, but you will also then start to break down fat in order to try and find an alternative energy source, and a consequence of that is that you will lose weight and then you will become thinner. So just to give you those 4 symptoms again, the 4 Ts are toilet, thirst, tiredness, and thinner. Now, if you recognise any of those symptoms in someone that you know or love, it's really important to approach your healthcare professional, raise a concern about type 1 or possible type 1 diabetes, and ensure that you get a blood test in order to make the diagnosis early. And hopefully, if we can make the diagnosis early, we can avoid presentation with DKA.